Welcome to this week's edition of AI, Machine Learning and Digital Health Updates by Lucid Quest. Let's dive right into the latest news. DxGPT arrives. Microsoft's GPT-4o Clinician Copilot screens symptoms, labs, and literature across 7,000-plus rare diseases in seconds. Heading to Azure Health Data Services, with NIH and Mayo pilots aiming to shrink the 5-year diagnosis odyssey to weeks. The UAE is sprinting toward an AI-first health system. Falcon, LLM, Med42, and Aeris TB drive a 34% compound annual growth rate in digital spend, while a new global AI healthcare academy trains clinicians in algorithm design and ethics. Children's Hospital LA launched Wise Hair, pairing Apple Watch with an app that captures 30 million nightly data points to flag pediatric sleep apnea risk and predict ICU admissions. Anthropic's Model Welfare Initiative asks if advanced AIs could experience preference or distress, partnering with consciousness scholars to probe moral status in future models. A virology capabilities test warns of dual-use risk. OpenAI O3 solved 44% of lab troubleshooting questions versus 22% by expert virologists, spurring calls for biorisk guardrails. Deep learning MRI with dual attention convolutional neural network detects multiple sclerosis lesions at 96% precision, even in tough cortical and brainstem regions. Researchers engineered 1 custom Cas9 variants and trained PAMmla to match editors to targets, delivering allele-selective gene fixes with fewer off-targets. An XGBoost model using 7 years of weather data predicts daily stroke admissions within 1.2 cases. Gusts, cold snaps, and heat waves trigger staffing alerts. Bayesian joint models now forecast when mild cognitive impairment patients will progress to Alzheimer's, offering an intuitive web tool for clinicians. ChatGPT matched specialist dentists on 74% of oral lesion differentials, hinting at chairside decision support once image inputs are validated. A dual-stream transformer reads Parkinson's facial cues via smartphone video, hitting 86% accuracy in levodopa on-off states for remote dose titration. Simulation shows primary care doctors miss 2/3 of seeded errors in AI-drafted portal messages, demonstrating that automation bias demands stronger guardrails and training. BigHat Biosciences teams with Eli Lilly, marrying the Milliner antibody design platform with Lilly's labs to deliver an antibody drug conjugate candidate clinic bound by 2026. How AI upgrades its SkinGPT platform with ingredient libraries, UV pollution modeling, and combo simulations for richer at-home experiments. Roche's CE-marked navify chest pain triage tool integrates high-sensitivity troponin pathways, cutting emergency department stays by more than 3 hours. Yale scientists use deep neural nets on biopsies to generate a quantitative scleroderma fibrosis score, promising earlier diagnosis than manual pinch tests. A balanced random forest combing EHR notes flagged 400-plus suspected mixed ATTR amyloidosis cases at 90% sensitivity, surfacing carpal tunnel and weight loss as key signals. Bayer's multi-year pact with ConcertA taps 9 million cancer LangQ records and multi-omics to optimize precision oncology trial design. Mount Sinai calibrated an FDA-cleared ECG algorithm to output numeric hypertrophic cardiomyopathy risk, improving triage across 71,000 traces. An NHS pilot app supports cardiac arrest witnesses, the forgotten patients, with real-time psychological resources and liaison officers. Open-source deep learning spots tertiary lymphoid structures on melanoma hematoxylin and eosin slides. Finding one or more structures raises 5-year survival from 29% to 38%. A wearable atom sensor with haptic feedback cut nocturnal atopic dermatitis scratching by 40% in pilot data, hinting at drug-free itch relief. AI co-pilots outperform physicians in 77% of 462 virtual care scenarios, bolstering the case for supervised deployment in telehealth. Nourish raised saw $1 million to scale its AI-powered nutrition platform. GLP-1 users coached by its dietitians lost 33% more weight than controls. CK Life Sciences showcased AI-designed cancer vaccines targeting PRAME, PD-L1, and more as its melanoma adjuvant nears late-stage trials. Stay ahead in AI and healthcare research. Like, share, and subscribe for weekly updates. Visit www.lqventures.com